This is the second video in the series on Helicobacter pylori and will discuss the complications of the infection. The interesting observation is that Helicobacter pylori is able to survive in the hostile acidic environment of the stomach when most other bacteria would die in such an environment. How is the Helicobacter pylori able to do so? Imagine this is the Helicobacter pylori bacteria. The bacteria is able to survive the harsh acid environment of the stomach because it produces an enzyme called urease. This enzyme converts urea to an alkaline substance called ammonia. The alkaline ammonia around the Helicobacter neutralizes the harsh acidity of the stomach. This allows the bacteria to survive the harsh environment of the stomach. Also, the tail of the bacteria called the flagella helps the Helicobacter to move and hide in the mucus. Mucus is the slippery fluid that covers the stomach wall and protects the lining. Helicobacter is better able to survive in the mucus area as it is less acidic. The body's immune system is also unable to reach the mucus area where the Helicobacter is hiding. Hence, it can thrive in an acid environment for decades without being destroyed by the body's immune system. Also, the bacteria uses a sort of gum to stick to the stomach lining so as not to be washed by the stomach acid. So as you can see, Helicobacter is a very clever bacteria. The germ produces a toxin which causes chronic inflammation in the stomach lining called chronic gastritis. It also infects the first part of the intestine, which is called the duodenal bulb, and causes an inflammation which is referred to as duodenitis. Most patients with gastritis due to Helicobacter have no symptoms. The same thing also happens with duodenitis, where there are no symptoms. A minority of patients may have symptoms like abdominal pain or discomfort, indigestion, a full or bloated feeling, nausea, frequent belching, and vomiting. Sometimes the Helicobacter inflammation causes more severe damage to the lining of the stomach or duodenal bulb by thinning the mucus layer that protects the lining from acid. The thinning of the mucus layer allows stomach acid to attack the lining, causing sores, which are called ulcers, as is indicated by the arrow here. About 10% of patients with Helicobacter develop ulcers. These are called peptic ulcers and are ulcers in the stomach and duodenum. The older the patient, the less likely they are to complain of pain. So many patients with ulcers have no pain or other symptoms. The stomach pain usually occurs in an empty stomach. In a small group of patients, the Helicobacter can cause a more serious complication, and that is a bleeding ulcer. What happens is that when the ulcer is deep, a blood vessel is exposed. The stomach acid can damage the blood vessels, causing a leak. If it is a small leak, a tiny amount of blood is lost, and the blood loss is often gradual. In this instance, a patient is relatively well other than feeling weak and tired because of insufficient blood. Anemia is a term that refers to insufficient blood. A more serious complication is a big leak from the blood vessel. This can result in symptoms of black stools and vomiting of blood. The stools are black and not red. The reason behind this is that the blood that oozes from the ruptured vessel is initially red when it is released into the stomach. It, however, changes to black color as it traverses the intestine due to chemical reactions by intestine enzymes. In this situation, the patient might lose so much blood that there is a fall in the blood pressure and the patient can go into shock. Of course, this is a medical emergency. Otherwise, the patient can bleed to death. So, a bleeding ulcer, either in the stomach or the duodenum, is a serious complication of Helicobacter pylori. A more serious complication of Helicobacter is that there is an increased risk of stomach cancer. After many decades of chronic gastritis, some of the stomach lining starts to thin out. This is called gastric atrophy. Sometimes some of the cells transform from stomach cells to intestine cells. This is called intestinal metaplasia. Both gastric atrophy and intestinal metaplasia increase the risk of stomach cancer. Sometimes stomach cancer can develop after many years of chronic gastritis and not going through the stage of gastric atrophy or intestinal metaplasia. It is estimated that between 50 to 60% of stomach cancers are due to chronic HP infection. Fortunately, the vast majority of Helicobacter positive patients do not develop stomach cancer. Only about 1 to 2% of people with Helicobacter will ever develop stomach cancer. It is estimated that the risk of stomach cancer in HP positive patients is 6 times higher than people without Helicobacter.